Welcome to the Dr. Tom Show. Today, I am really excited to bring things full circle with an amazing chiropractor joining us from California, Dr. Vivek. Now, Dr. Vivek is a upper cervical chiropractor, which we're going to talk about in a minute for those of you who don't necessarily understand that, with a heavy involvement in sport. He's also got a master's in neurophysiology as well as his doctor in chiropractic. A thirst for knowledge that is just insatiable, and I can't wait to delve into that, but really a passion for helping better humanity. So I know selfishly I'm going to get a lot out of today, but I know our audience is going to get a huge amount. Whether you are into sports or not, this is going to be incredible. So Dr. Vivek, thank you so much for joining us on the show today.
Thank you, Dr. Tom, for having me.
Absolute pleasure. And, you know, I want to start straight out of the gate in terms of explaining upper cervical to people who don't know. Like, what is upper cervical chiropractic? Let's assume our audience know what chiropractic is. What is upper cervical chiropractic? What is that, and why is it important to you and to us?
Yeah, and it comes down to the fact that we have enough bones and nerves, as we know, and we've all sat in the anatomy classes. But once we get to the top part of the neck, especially your C1, C2, atlas, there's so much neurology connecting the entire body. C1, C2 combines 100%, but 98% is coming from C1. And when you look at that, and I can tell you all the different facts, but the mechanoreceptors per gram of density, the most is in the suboccipital muscles. So this area is so complex that it's created its own specialty. From the founders and the developers, there's about 10 or 12 upper cervical techniques in the world, and the one that I do is part of one of the largest organizations, and it really helps get down to the specifics of how your neurology is affecting migraines, headaches, hormonal imbalances, children with neurodevelopmental disorders, but in my particular case, sports performance.
Amazing. So for those lay people, like if they put their hands on the back of their head, they're feeling their occiput. Is that right? And
yeah,
just
so you have that little bump at the back, and as soon as you slide down, there's like a little dip in there, and that's where that top bone in your spine sits.
And that is
as you move,
go on.
Sorry, say that again.
Please, you go on. You explain.
Oh yeah. So yeah, as you slip down and you feel that top bone in your spine, I mean, you can go slightly lateral, as if you feel like where sometimes your hairs create this like little pillar, and that's where the sort of pillars of your cervical spine are, and you'll probably feel around. Sometimes people massage that if you've had a bit of tension up there, and that's where your suboccipitals sit, and it's what they call a triangle, and it sits exactly like this. So when your head tilts left and right, or it turns, they're contracting.
Perfect.
And that's
those little bones are so the cervical spine is the little bones in the neck. Is that right? And it's protecting your spinal cord, which I assume is like the most important part of your entire body.
Yep. And that's the simplest part of it. Your spinal cord. So your skull has a little hole in the bottom, and that's where the tail of the brain, essentially your spinal cord, comes out of. And right at the base of that skull is sitting that top bone in the spine, and then part of the brainstem as well.
Wow. So, you know, I'm going to be the lay person in today's conversation, and I don't even pretend to have as much knowledge as you on this topic. So I'm going to accept the lay person's position. But my brain, I assume, is controlling every function of my body. Is that right? Every single function of my body. And it has to go down through there to make anything happen. Is that right?
Exactly. It's the simplest way I say to my patients is, what is your brain connected to? And everyone always says it's everything, right? Every cell, every tissue, the bones, the muscles, they all have communication to it coming from the brain. And your spinal cord is that communication highway. It's the motorway for the people in Europe. It's where all the different exits come off, and it's speaking to different organs, nerves, and tissues. Now, again, the reason why this region is so vital is, in particular, around that area, you have your brainstem that's responsible for things like your blood pressure, your breathing rate, and all sorts of more in-depth functions that's required that you don't think about, that your brain is just doing in the background. And that's why it makes this region even more important, because it can also affect your mood and how you think and how you function. And that's just like an overall blanket statement. And we could definitely go down into the details. But,
so I suppose the gist of it, it's not just pain, is it? It's like, it's you, essentially. It's everything to do with you. So
yes, yeah.
Would people know if they had a misalignment there? Would people necessarily know if they've got a misalignment at the top of their spine?
Yes and no. And this is, for the majority of the time, I would say no, especially with the sports performance, because pain's the last thing you feel. The check engine light going on in your car, you don't know it's on its way out, or you don't know it's broken until the light comes on. But at that point, it's too late. It was the 10,000, 100,000 miles wearing on the car. So our body is the same. Our body works in very similar patterns, where pain is one of the last things we feel, because we have such few pain receptors. And once we feel the pain, it's like, okay, we need to do something, because this is not normal. And living with pain is not normal. So of course, as chiropractors and as humans, we think, okay, when we're feeling in pain, societally, we'll go to our medical doctors, we'll go to our GPs, and we'll try and find that quick solve, that quick solution. But what made the engine break down? What caused the actual problem? And this is when I start working with athletes and just the general public, of finding the root cause of the problem. Because one of the best things I say is, if you have knee pain or low back pain, I trace it back to the top part of the neck and help get to the root cause. Because as your body shifts, it compensates. Because your eyes like to be level with the horizon, you do this, so then this shoulder comes up. Because this is uncomfortable, then you twist in your lower back, and then that's what causes that short leg, that hip pain, that knee pain, because you're out of alignment. Like that car that we spoke about, the tread on the tire is getting worn on one side more than the other if the alignment is off. When your body is out of alignment, it causes a compensation down the entire system.
Wow. So it's, so like, I can imagine my spine, I suppose, like a towel, and if I twist the top of it, the whole thing will start to twist all the way down. Is that right?
Exactly.
So you work in sport, and I can see how there can be big injuries, and obviously we want to fix after injury, but we're also going to go into performance as well, because my background is rugby, and I have taken a serious amount of head trauma. It actually ended my career with 7 days in hospital with a head injury. And so I know the American football world is doing a huge amount in terms of neck injury as well.
Yeah.
So most sports involve some kind of either quick rotation or physical blunt trauma. So are sports people necessarily more likely to get injuries of the upper spine?
It's a yes and no question. It's the nature of the sport. They're actually I think they call him the father of concussion out over here. Is Dr. Scott Rosa, who happens to be a chiropractor as well, Upper Cervical. And he's worked with a lot of American football players and hockey players, most famously ice hockey players, who've had TBIs, or traumatic brain injuries, concussions, and finding that the brain, because of that quick whipping motion, or that some sort of whiplash, that the spinal cord, as you mentioned, that towel, and if you notice when you keep wringing the towel, it sort of shortens, right? There's only so much give it has. That spinal cord pulls the bottom of your brain through that tiny hole. And that's what's causing a lot of those symptoms also.
Wow.
And yes, and it's an overlooked area. And they're realizing that they think that it's just impact to the neck or impact to the head. But if you've been continuously, and from my UK rugby days, not that I enjoyed them, there's continuous injuries and tackles to the side of the body. When you're thrown that way, right? Your spinal cord's been twisted, it's been pulled, your neck's gone that way. So if you can imagine, it's just that quick tug, and repetitive injuries end up causing these either microtraumas, or if it's big enough, in your case, was one major macrotrauma. It can start to cause other systemic problems beyond just having the concussion symptoms and TBIs.
Wow. I don't often go speechless, but that's maybe worry a little bit, but it's
And
go on.
please don't. Sorry, and I sorry not to cut you off. And I'm like, I realize I probably, and there should be some doctors speaking that not everyone's gonna. Yes, you can have microtraumas, and the beauty about what chiropractic is and does is that it's never too late. We're one of the few people who can jump to the performance side. We're one of the few people who can strengthen our spines before it gets injured, as well as look after it when it is injured. And there is a ratio in an old mentor of mine, Dr. Vivek, for every month for every year you're misaligned, it takes about a month of recovery, because your accidents and injuries cause the ligaments to stretch, tear, and compensate in the spine. And it's about regaining that spinal stability, especially in an area that doesn't have any like airlocked facets. It's just, which basically means open joints.
I love that. I like that analogy. I tend to say it's about 10% of the time it took to come on to start to resolve it. So it's similar to the month to the year.
Yeah.
So let's move beyond that. So we've done that 12 months. We've done that year to repay what we did. What about performance and going forwards? How can we, because people go through life and there are amazing athletes that have lived who haven't had chiropractic.
Yeah.
So what's the difference? What can it offer? And how would we know it's actually doing anything?
And that's actually one of the biggest reasons why I chose this technique that I do, and it's the objectivity. It's not about what technique you do, as long as you prove or say what you're doing. In what I do, we take pre and post X-rays as one of many objective measures, which is basically saying that this isn't us. We have very strict, down to the half a degree, quarter of a millimeter type of accuracy when taking these X-rays, pre and post. So we can show you after adjustment that this misalignment, this was that top bone in the spine, this is your head, and this is your neck, the bottom part here. Feel like this, we can get you pretty much close to dead center after one adjustment. The goal is to make sure you hold that adjustment. The beauty is not in getting the adjustment, it's allowing your body to communicate without any interference. That's when we get into the performance realm. And my question to you is how do you know your nervous system is got some sort of interference with? You don't. So until you know, you may be Usain Bolt running your best laps, who actually does get chiropractic care. Unfortunately, doesn't get any upper cervical care. We don't know for his particular case if that would shave half a second, a tenth of a second. I know from clinical experience, we're really looking at, on the elite side, the 2-3% gains. But when you look at it from a swimmer's standpoint or a golfer's standpoint, those 2-3% over a round, over a career, that's the difference of you winning 20 tournaments or one tournament.
That's so true. And you work a lot with golfers, don't you? Why did you choose to start working with golfers?
Love-hate relationship. I absolutely love the sport. I wish I was better at it. And it wasn't the easiest sports to break into as a kid, mainly because of financial, difficulties. And it was just, you go back for the one good shot. And I think I try and use that analogy as much as I can. You may, in any sport, you may have like one bad throw or one bad pass, more than that. And like, I know I have way more bad shots than I have good shots, but it's the good moments that you remember. And that feeling, and my friends and my family know I love golf this much more than chiropractic. And my colleagues know how much I love chiropractic, and a huge, huge advocate for what it is we do for mankind.
That's so amazing that you have been able to sort of marry up two passions of yours, to be able to make it work as well,
Yeah, I honestly didn't think this, it is a dream come true. I remember as a kid, I wanted to be a chiropractor since I was 9. I had all these crazy ideas of what chiropractic was and is, and then like being the European model and thinking that this is what I have to do. And when you start pigeonholing yourself, your dreams sort of get pushed aside because you think that it's going to have to fit into this tiny little box or circle, whatever it is. And yeah, I found a way to make it work. And I think that was my biggest challenge over the last 6 or 7 years.
That's so important to people to understand, whether they are chiropractors or not listening to this show, that you can take your passion and work on it. You've just got to go for your thing. Like, it's so easy to fall into, like, particularly sport. Like, I used to work a little bit with sports people with chiropractic, and it was very hard for me to say, this is all I am doing in terms of I am going to adjust you and that is it. And there's this like, well, can you just take my knee and can you just massage my back? And I'm like, well, that's not chiropractic. And there's people who are very good at that and I am not. So can you riff on that a little bit? Can you expand on that?
Yeah. And I laugh with this is because that's what I was told. That's what pigeonholed me. That I was in that boat of, I need to do the soft tissue work and I need to do the taping. Can you please just take my knee? And they see this on TV and I'm not saying there's anything wrong with it. It's just not what I do. And if you were awake and you didn't need to sleep, and you could use all 24 hours of the day to work on your craft. If I had 10, 20 different tools, if on average, I think when we did the poll, there's about 10 to 12 different modalities being done at any one time by a PT/physiotherapist or a chiropractor on tour. That's 2 hours of working on your craft. And I call it a craft because it is about not just about your knowledge, but it's about experience and gaining that and practicing that. If you divide that, and that's 2 hours a day, just working on the adjusting side of it, which is what you graduated for as a chiropractor. Over 10, 15 years, when I've spent 24 hours of a day, the difference in growth of how much experience I've spent, right? Like, would you want someone who's a jack of all trades or a master of one? And I'm that one trick pony. I only adjust up here, but it also gives you insight on how to work with other people, because there's so much you can learn about the human body that you now understand is, okay, this is where my boundaries are, but they're pretty big. What I can do for this person is pretty big, in knowing that you're humble enough to say, okay, this is not a chiropractic case. Okay, this is beyond what I can do. And I don't want to take money out of your pocket. I don't want to take people out of your mastery. Let's work together on this. And I think once we start to have that reciprocation and that genuine like love for the patient on the table, the person on the table, then we can start really helping them. Because doing 10, 12 different things, it may work, it may get you results. I'm not saying it's not helping them. I'm not saying it's bad. My question to people would be is, could you do better? Could you help them better if you were an expert in fewer things and you spent more time looking at the body as a whole and how you affect this system and what other people do affect that as well from a top-down perspective?
I completely agree. And I love that you said two words, like, are you the master of one? But some people would choose to call you the one-trick pony. And I think that's an insecurity. I think that's a misunderstanding. I would rather see the one-trick pony, aka master of one, than the jack of all. I mean, I've currently got my shoulder, I see those watching on YouTube, taped. I didn't tape it, and I see a physical therapist on a regular basis. And I encourage my chiropractic patients to see a physical therapist on a regular basis. And I am not scared that they're going to take my custom away, because they are very good at what they do and I am very good at what I do. And I think that what you've said there can be transferred to life. You don't have the golfers dabbling in football and, baseball at the same time. They are mastering their golf.
Yeah, their craft. That's what it is.
So important. And I like what you said, and I'd like to sort of discuss this as well. You talked about better serving mankind. You added it into your sentence there, and I really love that. What does that mean to you?
It's the simplest way I could put it is uh, leaving this earth or mankind better than I found it. Whether it's an eighth of a percent, 10%, whatever it is, it's just being able to give back all that it's given me in such a short period of time. Because as a young adult, as children, we're given so much, and like through education, through love, through parenting, and we're gonna, and throughout life. And the goal is to be able to provide opportunities. And one of my sayings is to really, I guess it's not a saying, it's one of like the taglines, or when someone really asks, is helping someone in their goals, in their lives, creating opportunities for others is what I end up saying right at the end. Is my goal is, in whatever way I can, is to create an opportunity for you. If that's an opportunity to hit the ball further, if that's an opportunity to be healthier, to play with your kids, from chiropractic standpoint, right? We can go through all of those different things. Or from the business side of it, when we coach clients, where we say, what do we need to do to create these opportunities to help your business grow, to serve the people that you serve? I may not be able to help 1 million people directly, but through the first degree, second degree, and third degree, by the time we compound that, if we can help as a society, not as an individual, we take our egos out and we start to get on that same wavelength. We all start to help each other, right? It's a huge, like I said, I could go on about it. It's a huge topic of what we can do. But to me, it's really just creating opportunities for others. That's my goal, to help mankind.
I really love that. And from what we said in the pre-show about how we first met and how that actually ties in with what you've just said, in terms of, we just start this thing and we can help someone have an opportunity, and that can then help somebody out, and it just spirals. And that's what's going to create it, because by ourselves, we can't help the whole of mankind, but together, collectively, we can make a huge difference.
Yeah. And here's I guess tying it all together is, when we adjust this up here, this isn't going to directly affect your knee, but as the spine starts to shift, as one feels the effect of the top one, and it works its way down, now that knee, that lower back, everything's shifting. It's in a completely different paradigm, because now there's communication amongst everyone, right? The rest of the spine, our bodies are a microcosm of the universe, and I put that in quotation marks. Is we see patterns in the human body as we do in nature, as we do in society, how cities are built, how people think. And that was one of the biggest principles that our founder, our developer, BJ Palmer, talked about, right? Help one person, and that person can help another person, and that person helps a town, that helps a city, that helps a country. And before you know it, you've changed the world.
So true. Vivek, you've given some amazing insights today, and it's really, you stunned me to silence at one point, which I think is amazing. Very rare that people do that. And I've learned a lot. Is there anything that you'd like to leave our audience with? Any particular parting advice or pearls of wisdom or experiences that you've had that you'd like to leave our audience with?
Two things, I guess. I know you said one, but the first one would be, before I wrap it up, is if you want to know more, if you have any questions, I'll go ahead and I'll leave one of my personal emails with yourself, and go ahead and shoot me an email. The reason why is we're building an organization, we're building a central database for all these resources, because it's not as easily accessible. So bear with us. It's a lot of information, but if you're in touch with me, you'll eventually find out, you'll know exactly where everything is. But I guess the life lesson, the biggest thing that I know and that I try and tell people, less is more. Less is more. And what does that mean to you? And how is less is more?
Amazing. Thank you for what you've shared with us today. I really appreciate it. And apart from that email, where can people find out more about you or follow what you're doing?
Yep, go ahead. I'm on Instagram, Dr. Vivek Soam. The Facebook page is slowly being built. And go ahead and check my my clinic page out, nimbusbrainspine.com. You'll be able to find out more about what NUCA is and all the different things that we do and how we're helping people. And you'll slowly soon see the sports performance added into that as well.
Amazing. Dr. Vivek, thank you ever so much for being on the show today. Really appreciate it. Thank you for joining us on the show.
Thank you. Thank you.